that's floating around. So it basically gives them an overall look at what problems could occur before they stick a needle into it. Basically, we have, using B-mode ultrasound, we have 200 micron resolution with commercial 20 megahertz systems. So basically, you can see the skin and the subcutaneous tissues. Now, we can measure normal skin thickness. It might be useful to know how thick the thoracic area might be as opposed to the front of the arm. Oftentimes, the breast is actually over 2 millimeters thick. So imaging allows you to look at multiple areas. The sonogram is actually better than confocal microscopy and the OCT, the optical coherence, because you have a broad field of view. You actually get more bang for the buck, so to speak. So here's a patient, 1, 2, 3, 4. What do you image? What do you biopsy? So we can see clearly this one's the basal cell, this is the bone, you can see the infraorbital nerve and the infraorbital artery. We can see this best in 3D because here's the Netter drawing, this is the nerve. The nerve in 2D you can't see, but the 3D opens it up so you actually can see the whole course of the nerve as the artery. So if you want to take the time, you can see arteries and veins and avoid hemorrhage and cutting a nerve. So here's another BCC with the depth. It takes seconds to do this with the right equipment. Now, the ALA, the curvature you can see, this was done to see the depth of the tumor to the cartilage, so you can tell the surgeon he doesn't have to go into the cartilage, and the patients feel better preoperatively too. All right, recurrent BCC we can see. This is the nose, the little bump is the basal cell, but notice how deep it goes. Still not eroding bone, but this will take the Mohs surgeon 2 days to do. Melanoma we can see in seconds with this technology. Nail, we can see the dorsal ventral plate of the nail. Psoriasis thickens it. Severe psoriasis, like most other severe diseases, is inflammatory, so these are the arteries and veins. Calcification, remember I said you don't want to stick a needle into a piece of bone that's just under the skin. Complications, we can see abscesses. A fellow with a previous history of a melanoma, we said no, it's a venous malformation. We can see malignancies in the skin that are non-traditional.